Today I'm going to be giving kind of an overview of PET and SPECT-based hybrid imaging systems with a little bit of an emphasis on preclinical imaging systems. So just some disclosures for myself. So just a question to start out with is, when is 1 + 1 greater than 2? Okay, so that's just kind of something to think about. And just one of the answers that this can be a case is when we're talking about medical imaging. Now, hopefully, we'll just show you some situations here. So here we have two images. One image was taken before therapy, and another image was taken after therapy. And in the first one, this FDG kind of, probably from the first image to the second image, you could see that there was a response to therapy, and qualitatively, it's kind of distinct. On the bottom set of images, those were taken with sodium fluoride, so they're a bone scan. And if you just looked at the images without seeing any numbers on them, they might look fairly similar. But as soon as you do something more quantitatively and look at them, you can see that there was some, not maybe a total response, but there was a partial response to this therapy. So this is one example where having the image before and after therapy gives you more information than just looking at the images separately. Because if you looked at them separately, maybe that second image, you may think that the person was still in a disease state. Another situation where having two images could be more than just adding two images together gives you more than two, is when you're using two different radiopharmaceuticals. And here's again a PET imaging. This is the same patient. One is using FDG, which is kind of a glucose analog, and it kind of shows us where there's tumor activity, because tumors tend to be have higher energy demands and take up the FDG greater. The second image is of this compound called fluorestradiol. So what it's looking for is estrogen receptors in these tumors. And so women with breast cancer, oftentimes they can have estrogen receptor positive tumors or not. And here, basically, we can see that if you look at the two images, they actually provide a little bit different information here. So we see that there's some correlation between the FES and the FDG, but it's not total. And so by knowing this, we can know that one, the person does have some of the tumors are estrogen receptor positive, and so that will be would have them go towards a certain type of treatment where you're taking these hormonal therapies. But the fact that there's still some FDG signal in some of the areas where there is not an FES signal, you know that there's some of the tumors are not estrogen receptor positive, so you're also going to have to do some other type of treatment, like some neoadjuvant chemotherapy. Otherwise, the cancer that's not estrogen receptor positive would continue to grow untreated. Okay. Finally, I'm going to, another type of when you have multiple images is when you have images where you have anatomical and functional co-registration. And here we have basically a CT image that's co-registered with a SPECT image. And in this situation, you're trying to make a diagnosis for this patient of whether this person was having facet arthritis, which would cause higher uptake of the SPECT signal of the SPECT tracer, or is this a pars stress fracture? And by being able to locate it on having the fused image, you're able to determine that the higher uptake area corresponds to a section of the pars area, and so this was a pars stress fracture. Okay. Okay, so what do we mean by hybrid imaging? Well, so basically hybrid imaging or multimodality imaging is the integration of two or more modalities like PET, SPECT, CT, MR, functional MR, optical, ultrasound, etc., where the images are being registered in space and or time. And this is just kind of a nice diagram of potential different imaging modalities for both preclinical and clinical imaging. This next kind of slide just gives you an idea of just some of the kind of the limits or of the properties of the different types of imaging modalities. And today we're really going to focus on PET and SPECT and its combination with these other modalities. And so one of the things that you can see here is that in general, the spatial resolution of PET and SPECT is not as good as some of these other like MR or CT, these anatomical imaging, and that's why they are make a good combination. The other thing that there's starting to be some combinations with is like with PET and some optical imaging, and so the spatial resolutions are on the same order, but they can provide complementary information still. Okay, so what are different types of hybrid imaging approaches? Well, this concept of hybrid imaging has actually been going on for years and years. When we first got PET systems, basically they would take a PET scan and put it up on a light box, and then they get the film from the CT and kind of look at the images and try to do the co-registration together just in their minds. But one of the things then they started doing was you could just do serial hybrid imaging, where the images are acquired on totally separate systems. They could be acquired totally different days, even totally different clinics, and you use software techniques to co-register the images together. This can actually work pretty well like in the brain, where you kind of have a rigid structure, but when you start going to body imaging, it becomes very difficult, because then you're not able to do rigid body transformations to get the images to align. You need to use non-rigid transformations, and that becomes much trickier. So with that, in the last decade or so, a little bit over a decade, there's been the development of these hybrid imaging approaches where the systems are kind of integrated together, and so that the images are now taken either simultaneously or nearly simultaneously in acquisition, okay? And so what this is, in general, the patient is not moved between the imaging sessions, and so it allows for better co-registration. So just in terms of, when you're looking at these hybrid or multimodality imaging, what are the advantages? Okay, and so again, the hope is that when we have a system a hybrid imaging system, it's just that the combination of these two images is going to provide us with added benefits than we get by just having the two images separately. So some of the things that it can do is to answer clinical research questions that could not be answered using the scanner separately if you just had to look at the images without the other image kind of co-registered to it. The advantage of these hybrid systems has been shown to improve the quantitative accuracy or functional or molecular imaging studies, to be able to allow the clinical or preclinical studies to be done in less time. And then one of the other, things that we'd want to do is to be able to reduce cost and time of the studies. So we'll first go over PET CT. This is probably the hybrid imaging approach that's definitely been the most successful. It's the one that's people are probably most familiar with. Commercially, it's been a huge success. If you look at the little chart there on the bottom right, when PET CT was first introduced in the early 2000s, most of the PET sales were of dedicated PET systems. But within like 3 to 5 years, basically, it went from 0 sales of PET CT up to 100% sales of PET CT, and dedicated PET systems were no longer being purchased. So that just shows that this technology was giving added value. Even though it was more expensive, it gives you added value that made people totally adopt it. Okay. So what is basically the design of a PET CT system? In reality, it's just basically a CT system and a PET system that have basically been put together in the same gantry, and one of the manufacturers still has them in separate kind of gantries, and they just share a patient table. In the beginning, the computer systems are totally separate. Now there's been more integration of the technology, but basically you're taking images of a patient and you're taking them sequentially. You're reconstructing them. You reconstruct the CT image, then using some of the attenuation information from the CT image, you use that and reconstruct the PET image, and then you just fuse the two images together for interpretation. Okay. And so what are the advantages of PET-CT? Well, the primary advantage, and the reason why it was first developed, was that it gives you anatomic localization of the functional image. So it just helps you to know, let's see here. Yeah, so like this little hot spot here in the PET scan, it shows that it aligns really well to this little nodule here in the CT, and it gives you higher confidence in terms of making the interpretation of the CT. A lot of from the radiologist perspective, that the PET scan is, or the FDG is the ultimate contrast agent for oncologic imaging. An additional benefit is that basically with the CT, it allows you to get your attenuation correction much faster. In general, with the spiral CTs, you can get the attenuation information or the CT scan in the order of seconds, where traditionally with the dedicated PET systems, it took minutes to tens of minutes to get the attenuation information. So it allowed you to get less noisy attenuation information and also quicker to allow you to image more patients and to increase throughput from your clinic. So it also saved money in that sense by being able to do more patients per day. Okay, so what are the challenges of PET-CT? So first of all, the CT images are not taken at the same energy as the PET images. So PET, we're dealing with 511 kV photon. CT, basically you're dealing with a polyenergetic range of X-rays down, 60, 80 kV range. So you have to scale to convert the Hounsfield units to the PET attenuation factors. The CT image isn't necessarily quantitative. You're not dealing with a single energy source anymore, and so there's the actual Hounsfield numbers are not super quantitative. There are different imaging fields of view. So basically, one of the issues has been that there could be truncation of the CT image. In general, because the CT images are taken so quickly, you have people lift their arms above their head, so their arms aren't in the field of view. With the PET images, sometimes you can do that. Other times, when you're doing whole body studies, because of the length of the study, you keep the arms in the field of view. So the fields of view of the CTs, in general, have not been as big as the field of view of the PET images. The images are taken sequentially and over different kinds of time periods. So with the CT images in general, they're going to be a breath hold image. With PET, the patient is freely breathing. So there's potential for mismatches of the attenuation and the emission data, which can lead to artifacts in the images. CT images, for diagnostic purposes, are taken with iodine contrast. And basically, that when you have that contrast in there, it affects how you scale the attenuation image up to the PET numbers. Also, CT images are affected when you have any type of metal in the field of view that causes artifacts in those images, which can then be translated into the PET image. And then with the CT image, that there's a reasonable radiation dose that's associated with it, and so that adds radiation dose on top of what the patient is getting for the PET image. I'm just going to go over this quickly because I want to focus more on preclinical stuff, but basically there's things that have been done to kind of address each of these issues, or things that people are working on. So for the first one, you can use bilinear scaling to deal with the fact that the CT numbers are different than the PET attenuation factors, and so they use a bilinear scaling to make that correction, and that works pretty well. CT image is not necessarily quantitative, so there's research in terms of doing dual energy CT, where you take CT images at different energies, and by using that information, you can create basis functions to basically get a more quantitative estimate of the attenuation of the CT image. And so there's dual energy, and then there's also what we call should be spectral CT, where you're using multiple energy windows there. So that would increase the quantitative accuracy of the CT images. The different transverse field of view, there's simple, straightforward techniques of just doing extrapolation of the CT images at the edge of the field of view, which is shown to work quite effectively. Image taken sequentially and at different time periods, there's many techniques that are being proposed. A lot of them are based on basically taking cine-CT. So you take CTs of the patient breathing. So you have a CT of different phases of the respiratory motion, and then you do respiratory motion tracking during the PET scan, and then you can build those two, those images together to basically get a frozen frame image where you're not getting the effects of the motion. Again, with the CT iodine contrasted metal, you could go to dual energy CT. And then for the issues with the radiation dose associated with CT, you're starting to go to iterative image reconstructions for the CT images. Now, CT image data sets tend to be really big, so it's computationally demanding. But with the increase in processor speeds and things like that, this is now a possibility. Okay, so what about for small animal PET CT? What are the differences, or what are some of the different challenges or strengths? Well, one of the things that is quite different is that, especially for mice, attenuation is not very significant. So that reduces one of the problems there. For small animal PET CT, one of the nice things about it is that it supports multi-animal or high throughput imaging. So if you didn't have a fast attenuation source, then it wouldn't be as helpful. But having the CT allows you to do multiple animals. One of the challenges is just the size of the animal. So as Dennis showed earlier, that it's difficult with the nuclear medicine imaging to get super high spatial resolution. So you end up having issues with partial volume effects that affect your quantitative imaging capabilities. CT systems on small animal PET systems are different than clinical CT systems. So clinical CT systems take images in fractions of seconds. For the small animal CT systems, they basically take on the order of minutes to acquire the data. So you don't have that same problem with mismatch in terms of the time frame for the images, but on the other hand, you're not freezing motion in the small animal CT. The other challenge is that the physiologic processes in small animals is much faster than in humans. They're breathing faster, their hearts are beating faster, so it's difficult to freeze that motion. With a human CT imaging, there's vascular contrast agents, but because of the length of time for doing the imaging, those really are not very useful or effective for small animal imaging, especially in mice. There is the option of potentially using IP contrast agents. And one of the other ones is that, radiation dose goes up with significantly when you try to go to higher and higher spatial resolution. So there's also the issue of a significant issue of radiation dose when you talk about small animal PET CT imaging. Okay, so let's just look at, again, a small animal PET CT system. It's basically similar in design to a human system. You basically have the PET part right here, the CT portion here. They basically share a bed, and so it basically kind of operates the same as a human clinical PET CT system. There's a lot of companies that are making these systems right now, and this kind of just is an example here of just, the CT. This is a sodium fluoride bone scan, and the fused image together here. This next slide, I don't know if I'm going to be able to do this with a click. Nope. Okay. Anyway, this is, if you can click on the image there. This is just yeah. So this is again just showing how having this PET CT enables multi-animal imaging. Again, this is a sodium fluoride bone scan. You see the CT image. You can see the bone structure very nicely. You can see the PET image is just the color image that's overlaid on it. But having the PET CT definitely helps with throughput and get some pretty nice images in terms of the localization of where the activity is going. Okay, let's move on to SPECT CT. So SPECT CT, again, there's a lot of commercial systems that are out there. Again, what you're seeing here is your SPECT image, which is even blurrier, especially for clinical purposes, than your PET image, and you can see it fused with a CT there, and you get very good localization of where that activity is. Again, you're seeing that same thing in that image there on the bottom right. Okay, so some of the advantages is, again, the main advantage is the co-registration of the functional and anatomic images. Leads to significantly better anatomic localization of the SPECT results. A second advantage, significant advantage, is that with SPECT CT systems, it's really enabling quantitative SPECT. Now, PET has been quantitative since its initiation, but in general, SPECT is viewed, SPECT images are interpreted quantitatively. And the main reason is that because attenuation correction, as Roger had talked about earlier today in SPECT, it basically is depth dependent, where in PET, the attenuation is not dependent upon where the event occurred on the line of response. And because of that depth dependent attenuation, you can't just use simple filtered back projection to make it with attenuation corrections. And so it's been a little bit more complicated. So, but basically having now a nice attenuation mask image and iterative image reconstruction techniques also that Roger went over, you're able to now start doing quantitative SPECT imaging. And again, another important, we'll talk about just some of the things of the modeling of your system to be able to do the quantitative SPECT imaging. There's recently been introduced a more optimized integration of the SPECT and CT imaging in terms of using doing the SPECT reconstruction in the CT image space. And I'm not going to show an image on that, but some very interesting things going on in that area for the clinical systems. Otherwise, the challenges are similar to the challenges associated with PET CT. Again, just showing, we saw this image earlier, just showing how having the high resolution SPECT and being fused to the CT can help you with diagnosis of a patient. Here, I want to show a little bit about just now the importance of being able to use these iterative reconstructions with corrections in modeling of the system and having attenuation and scatter correction. The top one is the patient with an indium-111 octreotide study. The first image here on the left is with just filtered back projection. The second picture is with OSCM, but without any type of detector modeling of the system. And the final image, you're actually modeling the collimator detector response function. You can see the stark improvement in the image there. And then down here on the bottom is a iodine-131 study where because of the iodine-131, you're imaging a very high energy photon. It's very important to be able to model the collimator detector response. And you see that by having all the additional informations that you get with SPECT CT, you're able to get a significantly improved image versus what you would get otherwise. Okay, so what are some of the differences or what are some of the constraints for small animal SPECT CT? Well, one of the things that, as Dennis introduced, was the fact that the detectors for small animal SPECT are different, or the collimators are different than what is used in human imaging. And so you can use these ultra-high resolution pinhole collimators to provide fantastic spatial resolution. Now, those pinhole collimators, they have a limited depth of imaging field of view, so they're not real practical for human whole body imaging, but for mice, they work fantastic. So you can get very high spatial resolution. Again, the big advantage is that you get the co-registered functional and anatomic information, and you could, again, do the quantitative imaging. So let's again, there's a lot of small animal SPECT CT systems that are on the market right now. Want to again talk about the fact that Dennis kind of talked about this already, but one of the things that's really nice about these small animal SPECT CT systems is the use of these multi-pinhole collimators, where basically you're able to get super high spatial resolution. And they use the multiple pinholes in order to get reasonable imaging sensitivity to be able to collect your images there. So these are just two different versions of the multi-pinhole collimators that are used by different manufacturers. Okay, and this is again showing an image similar to one that Dennis showed, but just showing this is a a SPECT bone scan here with about a quarter millimeter spatial resolution. And when you can see, these are mouse bones. And so when you get spatial resolution on this order, maybe you don't need the CT anymore for the anatomic localization because you're getting such fantastic spatial resolution for the SPECT. But this is, part of a SPECT CT system here. Another example of just kind of a SPECT CT image here is you basically have the CT image there on the right, the fused image there on the left, where you're looking at it more in a bone window for the CT image there. But showing that on the CT, you have two tumors here. One has a slightly different kind of genetic factor. I guess one's IGF negative and one's IGF positive. Using the tracer here, it gets taken up in the positive tumor and does not get taken up in the negative tumor. So again, just a showing example of using SPECT CT for small animal imaging here. Okay, as well as just kind of the PET CT or SPECT CT, a bunch of these companies have actually made tri-modality systems, and just kind of showing them there. This one is actually a human tri-modality system, so just a combination there. Here, actually, I guess I will go back here. So one of the interesting systems was this one here, this system up here. Again, this was a micro-SPECT, micro-CT system, and they added micro-PET to it, but rather than doing coincidence imaging for the micro-PET, for the PET imaging, they used a collimator, a specially designed pinhole collimator for the 511 images, and they got, high quality PET and SPECT images. So this is using that vector system. So these are acquired doing both SPECT and PET simultaneously. Again, both using collimation, pinhole collimation techniques. Okay, so one of the things that people are very excited about is PET MR systems, and there's kind of two types of systems here. There's systems that are integrated, where the PET detectors are integrated into the MR imaging field, and the images can be acquired simultaneously. And then there's also systems that have been developed where they can be more like a PET CT system, where the images are acquired sequentially. So going to really focus more on these integrated systems here. So the potential strength is that with PET MR is that you have excellent registration of structural and molecular data, and you have better soft tissue contrast with MR than CT. So that's one of the big strengths there. Again, having that anatomic information, you can use it in your image reconstruction to try reduce partial volume corrections that are by incorporating the high resolution information in your image reconstruction. MR offers a lot of different types of pulse sequences and imaging techniques, like functional MRI, diffusion weighted, and then like MR spectroscopy. So there's a lot of different options that can be done there. There's no additional radiation dose, so that CT radiation is something that is a little bit of a concern. So that's another positive there. And then one of the things that's really kind of cool is that with MR, you can actually do these navigator or tagging sequences to actually to monitor motion of the organs during the PET imaging session. And so you can use it for motion correction of the PET data. Okay? One of the the challenges or weaknesses is that they're much more expensive than a PET CT system, and basically to get to make the PET ring bigger and bigger as you make an MR system bigger, the cost kind of goes up exponentially. The other thing is that the attenuation correction is not directly measured in MR, so that you get this really nice image, but it doesn't really contain any attenuation information, so you have to kind of figure out a way of doing that. So right now, there's also, just in terms of the cost, it's unclear what the clinical role for PET MR will be. Okay? But here's just, again, demonstrating the difference in terms of the soft tissue information that you get. On the bottom row here, you have the PET MR images, and the top row, the PET CT. And you can just see that there's so much more anatomic detail in the MR image than in the CT image. Okay, so for small animal PET MR, again, you have that excellent registration of structural and molecular data. You get, again, having that extra additional soft tissue contrast is benefit. Other things are the same. Again, no additional radiation dose is a big thing there. The main weakness, again, is just that the simultaneous PET MR is more expensive than the PET CT. But here, for research purposes, probably, if you can afford it, the PET MR is the way to go. And again, especially because of the radiation dose and the better soft tissue contrast. Okay. One of the manufacturers actually came out with a sequential PET MR system, small animal PET MR system. This is using a permanent magnet, so it's just a little system there. And again, just highlighting the fact that here's the MR image, the whole body MR image versus a CT image of an animal, and you get so much more anatomic detail for understanding the localization of where the activity in the PET images went. So just going over to now, so some of these integrated systems, this is a system that was developed at UC Davis using avalanche photodiodes, and this is the PET system there. Basically, it gets put into the bore of the magnet there. They have the coils for the MR coils and stuff like that. And just showing some images here. This is an FDG image of a mouse, and just showing it overlaid with the MR image of the mouse, just showing the good understanding of the anatomic localization of the activity. The other thing that they've done here is that they've done some FDG PET with MRS spectroscopy, and here they're looking at the different sections of a tumor here, and just showing that there's, for the high activity uptake of the FDG, is also they're seeing a high level of choline peak there. A lower activity level of the FDG, the choline was lower, and then in the muscle area there was basically no choline uptake. And the high choline may be suggestive of a high membrane turnover rate, indicating cellular proliferation of the tumor. And so this is, again, another way of showing, getting different types of information of the images using these two different types of imaging modalities. Here's another kind of PET MR setup. This was given from the Tübingen. And here they're basically looking at, C11 choline PET image, T2 weighted MR image, and then this MR chemical shift imaging here. And they're just showing kind of the different volumes of tumor. So the blue is the PET volume, the red is the T2 weighted MR volume, and the black is the chemical shift imaging tumor volume for the MR also, and just showing that it's giving some different information. So this is something that's quite interesting. Here they're showing work that's done using now functional MR, this bold technique, and then using kind of brain activation to look at brain activation in the animal, and showing the different regions that are taken up by the different types of imaging modalities there. Again, now we'll move on to SPECT MR. There's that same company is making a sequential SPECT MR system. Again, having the MR, you can see that you have better anatomic information than you do in the CT, where you're getting a lot of bone information but not much soft tissue information. Okay, just want to kind of close on some of these are some things that are actually going to be presented at this meeting. So there's a small animal simultaneous small animal SPECT MR system that's being developed at Johns Hopkins. Basically, again, some of the same things that we talked about earlier there, has some of the same issues with the PET systems, but in addition, they had to come up with a collimator that was going to be able to function in an MR system. This is just, again, you're going to hear more about this at this meeting, so I won't go over too much details on this, but just showing some of the images here that they've got, the SPECT image here, the MR image here, and just the fused image over here. One other thing, kind of modality I wanted to think about in terms of multimodality was this PET and SPECT motion tracking. So oftentimes we think of things being really complex here, but here they're doing SPECT or PET imaging, and then I'm just kind of call this optical tracking system as another imaging modality. But they're basically placing like a little optical thing on top of these mice or rat heads, and they're tracking the motion of the mouse or the rat during the imaging session so that they can do brain imaging studies on awake animals. Because, of course, if you anesthetize them, it's going to affect the imaging of their brains. And here you see that this is what the image would look like if they didn't use the optical tracking information. Here's what the image looked like when they use the optical tracking information to correct for motion of the animal. So very interesting things that's going on in Australia. Final thing I'm going to talk about is just PET fluorescence imaging. Again, this is something that's going to be talked about here at the meeting. Again, the strengths of this is you can image multiple molecular imaging agents or reporter proteins at the same time. There's a number of different application areas that this could be used for. Here, basically, they're combining fluorescent imaging with PET imaging. So for the fluorescent imaging, you have a laser that basically excites the subject. They look at the fluorescent signal that comes off that. You also have kind of another laser setup for, I think, calibrating the system there. They're integrating this. This is work that's being done at UC Davis. It's being integrated with their MicroPET 2 system, and they're showing some initial images showing the multimodality PET and fluorescence imaging studies here. So again, I encourage you to go to their talk if you're interested in learning more about this. I'd just like to thank some of the people that sent slides to me, and that's kind of concludes my talk. Thank you very much.